on, everybody? It's Hershee Love here, and this is the Hershee Way. So as we all know, COVID-19 has been affecting everyone across the world. Millions of people have filed for unemployment. Some people are working remotely while others have only been able to partly do their job. So I want to take a different approach and see how this virus was affecting people in the dental industry. And I have Mr. Randon Campbell here. He is studying to become a sports dentist, and he's going to talk to us about how this virus has been affecting him. So thank you so much for joining me.
Thank you for having me, Hershee, and thank you for that wonderful introduction.
Thank you so much. So can you start by telling us what's your major, what year you, and what school do you go to?
Absolutely. So I am currently a fourth-year dental student at the University of Michigan School of Dentistry. That is a dental school, which is considered a professional school. So at the end of my program, basically by next year, I'll have what's called a terminal degree and a DDS, which is a Doctor of Dental Surgery. So in about a year, I'll be a doctor.
Okay, awesome. Congratulations. You're almost there. So what made you interested in wanting to be a sports dentist?
So to be, I guess to be more specific, so I do have an interest in sports dentistry. However, that's only kind of like a one part of what I really want to do. My end goal is really to be a general dentist, what they call like a super GP, a super general dentist, where I'm actually able to do everything from cosmetic dentistry, sports dentistry, implants, dentures, everything, orthodontics, all that. But sports dentistry is one of my passions. Having been in athletics, kind of growing up, and also, being from South Florida, which is, in my experience, football capital of the world.
Yeah.
You know what I'm saying? So that's kind of what I want to be able to come back and give back to my community in that way. And I know a lot of kids are, doing a lot of sports. And so if I'm able to kind of make that easier for them, to allow them to, not have as much trauma, not as many teeth get knocked out, things like that, then that'd be great for me. Yeah.
Okay, so you kind of spoke on it a little bit, but my next question was going to be, what is the difference between sports dentistry and just being a general dentist? Like, do you learn different things, or you guys learn basically the same thing?
Yeah, so actually sports dentistry, so in dentistry, you actually have about 9 different specialties. So things like orthodontists, people who like specialize in just doing braces, endodontists doing root canals, or oral surgeons, those are like specialists. Whereas sports dentistry isn't really a specialty per se, but it's more so just something that, if you choose to, spend your time learning that, then you'll be doing that. So any dentist can really do sports dentistry. Prosthodontists can do sports dentistry, general dentists can do sports dentistry. So as a general dentist, you really have access to everything within dentistry. As much as you want to learn, you can do, essentially.
Okay.
Yeah.
Got it. Okay, makes sense. So how has the virus, when it first broke out in February, late February, how did it affect you?
Oh, it was crazy. So at the dental school, I am actually currently seeing patients, even though right now it's kind of weird because, everything's shut down. The government shut down. But I was actually on my hospital rotation. So in the school's 3rd and 4th years, they sent us to different places to learn more and kind of be more involved in the field outside of just the school. So I was actually working in the University of Michigan Hospital, and there, we were seeing all kinds of cases, special needs patients, people who were, literally on ventilators, intubated. It was crazy. And so when that started breaking out, in February, March, we were still there in the hospital. We actually saw like the first COVID-19 patient in Michigan at the hospital. And that went on for, I think I was on a rotation like a week and a half before they was like, yeah, just go home. So it was actually kind of crazy. And so since then, we haven't even really been back in school like full time. It's just kind of been emergency cases only.
Got it. Okay, that's also what I read, was that some people, they were only able to see extreme cases, but overall, a lot of these offices have been shut down. I've also seen some people are starting to reopen now. Have they spoke about that at all?
Yeah, they have actually. So in Michigan, I want to say they're trying to reopen stuff for elective services like cleaning, filling, just routine care. But right now, the school is saying that there won't be like a full return to clinic until like September or so.
Mm-hmm.
However, they might start letting people either like volunteer for emergency cases starting in June.
Okay.
So
is that something you'd be interested in?
Oh, absolutely.
Okay, great.
I love being in the field. I love it. I do.
Okay. And then I know that there was some talks about possibly doing mobile dentistry, which is like taking some of the dental instruments and going to people's houses and working on them. Now, to me, that sounds a little bit risky because now you're kind of inviting yourself into someone else's environment. You don't know if they've been properly protecting themselves with this virus going on. So is that something that they have like kind of shut down that idea for now, or is that still being talked about?
Lately, I haven't heard anyone talk about it for the reason that you said. You know, it is a huge risk, and when you really think about it, especially like with COVID kind of being a primarily respiratory disease, something that's kind of like more like airborne-ish.
Mhm.
Dentists and dental hygienists, people in the dental field are kind of at the highest risk possible because of the
Exactly.
equipment we work with. Our tools, people call it a drill, handpiece, same difference. But, when people get cleanings or when they get a filling, there's a lot of air, there's a lot of water that's being spread out. And so that actually raises the risk of contracting the disease. And so with going to people's homes, I don't know how viable that is right now because there's a lot that has to be done, even within the school, even within dental offices, in terms of like, suction the air, getting like pulling the air, that's being released, when we do work, separating people out, separating patients, so this person doesn't give this person COVID or another disease, some stuff like that. So it
Right.
is actually kind of risky. So I haven't really heard much about that lately, but they have released more like guidelines and like practices or like intentional practice, like or what people intend to do as we come back to clinic.
That was actually going to be my next question. I wanted to know if you could talk a little bit about that and what some of those guidelines are. How are they different from the previous precautions that dentists have had? Because obviously, like we said, like you have to work in people's mouths, so they already had procedures laid out for how to maintain cleanliness. So how is that different from what it was to what it is now? I know they have the mask and everything now as well.
hmm So we have been using masks. I think it's really interesting that you say how's it different now, because I was reading like before that even like 30 years ago, dentists weren't just using masks, gloves, goggles. Like that wasn't even a thing. They were reusing needles. It was crazy. 30 years ago, like
Mm,
30 years ago, right? But AIDS came and changed that. So what's happening now is kind of like what's happening when people had the AIDS panic, where we're having to change a lot of our practices. So
got it.
so special kinds of masks, right? N95, the KN95, like the knockoffs or whatever, the
Hmm.
respirators, like better suction devices, like stopping the use of certain procedures. So like where like usually if you were doing a filling, like if I was doing a filling, you would use like the drill, the handpiece, right?
Hmm.
Nowadays, it's kind of cautioned against that because that would be releasing the air, the water, the aerosol, they call it. So instead of
Right.
doing that, it's more like hand instruments. It's more like actually, so put some muscle behind it.
Hmm.
To actually kind of do a filling. So that's changing. There's more like air filtration devices to like cycle air through the office and kind of like filter everything out. So there's a lot more of that. And so the people who are in those industries, I'm thinking that they might be making some money. If you find a way, to make this stuff safe, your pocket's fat.
Right. So do you believe that some of these new precautions that they're taking, some of these new guidelines, do you think these are going to be now permanent, or when this virus starts to go away, do you think they're going to be rid of those guidelines a little bit or be loose on it?
That's a good question. I think some of them would be permanent. I think that the devices that are made to like control the aerosol, so like better suction devices, like I saw one where they had like a suction attached to a mirror, which is actually really interesting to me because that kind of catches everything. I think that might stick around a little bit better. I
Hmm.
think practices like using a rubber dam. Have you ever heard of rubber dam?
No.
I'm sorry,
You
I don't
talk to
mean.
me a little bit about that. No, it's okay. It's okay.
Yeah. I'm sorry, I know I'm using a lot of technical language, but like rubber dam is kind of like you ever heard like a dental dam?
Mm-mm.
All right, it's kind of like a piece of rubber that kind of like just kind of goes over your mouth, and you could punch holes in it, and you could like So it's it basically just kind of like covers the whole mouth, right?
Okay.
So, it pushes your tongue out the way. You can't like spit anything up because the rubber dam's in the way. I don't know. They talk a lot about it for like sex ed stuff, but
Okay.
different uses. Yeah.
Okay, and then also I know you were talking about how with some dentists they do only extreme cases or emergency cases. What do those cases look like? What is considered emergency cases?
Okay, yeah, for sure. Emergency cases. For anyone that's out there listening, like if you're having any really like serious pain, go to the dentist. That's emergency. If you're having swelling, go to the dentist. That's an emergency. If you are, what I'm saying, if you push on your cheek and you see pus come out of your gum,
Ooh.
that's an emergency.
Ooh.
That's an emergency.
I'm not gonna lie, I did not know that was a thing.
Yeah.
Did not know that was a thing. So wow,
Yeah.
okay.
Yeah, it's called an abscess. It's called an abscess.
Okay. Oh gosh.
So
Wow.
if you're feeling that, go to the dentist.
Okay, got it. So switching gears a little bit, I know you call yourself the trap dentist. Can you please let me know why?
So the trap dentist, it was actually I actually didn't come up with the name. Actually, a patient and good friend of mine actually came up with it. What their reasons behind it was, I couldn't tell you. But
Okay.
if it was either between the kind of music I play when I'm in the office, or stuff like that, or just like my attitude, I'm a real entrepreneur, real hustling. Maybe that was the reason. The way I tend to think of it is, you really only have a couple of recession-proof industries, right? And I say like medicine, like I said, like medicine is a recession-proof industry. Everyone's always going to need medicine. Everyone's always going to need dentistry. And trap house, what I'm saying, recession-proof industry. Everybody always going to get their fix. And as a dentist, it's kind of like I got a legal trap,
Yeah. That's a good way to think about it.
I got a legal trap, and it's in times like these when people have, when people either have an emergency case like that abscess, or they want to get some veneers, they got a cavity, they ain't paying, they need a root canal. My trap is booming.
Yeah.
You know what I'm saying?
I like that approach. Okay, so you talked about how you are a hustler, how you are an entrepreneur. So you have a jewelry. Is it an online jewelry shop, or do you actually have a building?
No, I don't have a building. It is an online shop.
Okay.
I started my first year in dental school because that was actually the first time I got hit with student loans, and I was like, yeah, this ain't the move. So, so you hear me?
Yeah, so it's called the Humble Merchant Shop.
The Humble Merchant Shop.
Okay, can you tell me a little bit about it?
Yeah. So Humble Merchant Shop, it's the primary export is like dental jewelry, like the necklace that I have on. I've been wearing the same necklace for like the last 3 years because literally like it's still the same color. I go to the beach with it, I can shower with it, go to the gym with it, and it's solid. So stuff like that. We have the Humble stethoscope that's usually goes to like med students. They really love that.
That's my favorite too. I'm not gonna lie. I was like, I can't even get it because I'm not in med school.
No, you can get it. You can get it. Just link me after this. I got you.
Okay.
So I got those. I also sell shirts, different kinds of like merchandise. I have hats, a lot of like really cool hats. I think y'all should check out my hats. My hats was actually booming. Like my first year, my hats was like the number one product. But yeah, so I kind of focused on my chains because being a dental profession, the people that I see is the people I'm trying to serve. So yeah.
Okay, well, thank you so much for talking to me about all this. Please let everybody know where they can find you and even find your merchant shop.
Absolutely. You can find my shop at ahumblemerchant.com. Again, that's ahumblemerchant.com because I'm the humble merchant. So ahumblemerchant.com. You can find me on Instagram as the Trap Dentist. That's THE Trap TRAP Dentist. Okay. So the Trap Dentist. I'm on there. I just try to share y'all some stuff about my life as well as a few tips and tricks for taking care of your oral health. And really what I'm trying to do is, one, to teach people, take care of your health. You know, don't do it for me. Do it because you love yourself. You know, floss your teeth, brush your teeth because you love yourself, really. And also just want to show people that it is possible to become a dentist. You know, this field is very very snowy. Okay. So I don't, you know, so take from that what you will, but you know, dentists, black dentists only make about, I think about like 3% of dentists, you know, in the whole country. And, you know, it really is possible. And I just want to be a guiding light and just let y'all know that it is possible. You don't necessarily have to be, you know, Mr. Moneybags to become a dentist. You ain't got to be top educated to become a dentist. Well, you got to be top educated to become a dentist, but that's a process. And it's all possible. It's all possible. You can go to HBCU and become a dentist. It's possible. You can do this. You can do these things. And just wanted to show people the lifestyle. Mm-hmm.
Well, thank you so much for joining me, having this conversation with me. You definitely said a lot of great things, a lot of informative things, and I'm definitely going to let them know where to follow you. And thank you all for joining me here for the Hershee Way. This is Hershee Love here, and we're signing off.